Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
What's up? Welcome to Nurse.org, Nurse Converse. Today on the podcast, we have a great episode for you today. The podcast title is Breaking Stereotypes, the Male Nurse Experience. My name is Joscel James, and today I have a couple of my buddies with me. We're going to talk about the male nurse experience, what it means to us. We come from a very diverse, different nurse backgrounds, so I'm excited to chat today.
I'm Brian. I'm a nurse of 12 years, and we also got...
I'm Zach Shepard, and I have been a nurse for the past 12 years as well. My background is ICU and travel nursing specifically. And yeah, jazzed to be here and excited to talk about male nursing with some awesome male nurses that I respect very much. Maybe we should just jump right into it, guys, and passing it off to Brian. Brian, what inspired you to become a nurse?
So this is like a kind of simple thing. I think Joscel could go along with me with this. Just being Filipino, and our parents automatically tell us the only thing that we're allowed to do is pretty much become a nurse. So that's how I got into nursing. I'm actually going to say that it wouldn't have been my first choice at all if I had to do it all over again. But that's how I got into it. And after being in school for 2 years, I ended up liking it, and then I ended up finishing it, and then here I am, like 12 and a half, 13 years later, still a nurse.
Agreed. I think I'd have to agree with Brian, just like he said. My mom was like, hey, you're going to be a nurse. And that's it. And that's how I got my nursing license.
Wow. Well,
yeah, I was born.
You were born. Yeah, well, maybe not similarly. I grew up in a very medical family. My dad is an MD and kind of just grew up in hospitals and grew up like rounding on patients with my dad and like drawing blood in his clinic when I was really young. And yeah, I just always kind of knew how hospitals worked and how they ran. And I thought nursing was cool. And I thought nurses like my dad is definitely one of those doctors who really values that like patient clinician relationship. And so I think I saw the good that we could do, and I saw the good I think that like someone who really cared could do for our patients, and whether you're a doctor or a nurse. And so, yeah, that kind of drew me to nursing, just because I know nurses got to be where the people are, and we interacted so much with patients.
Let me follow up on that. So your dad's a physician. What made you choose like the nursing route in general over going to like med school?
I've kind of bristled at times. I like whenever a patient asks me that question, I'm not offended at all. And I kind of answer it just how I just answered it, which is like, I like working with people. But there's a part of me that doesn't like that question, because it's kind of like saying like, well, why aren't you more important than you are? And I'm like, well, I think this is important. I bet your loved one lying on the ventilator in the ICU thinks it's important right now. And so, it's kind of like a strange question of like, oh, you're really smart. Like, why did you become a nurse? And I'm like, that is kind of like, I mean, and again, like, I don't think patients mean it in a harmful or mean way.
Your dad never wanted you to be like go into medicine.
No.
Was there any kind of thoughts of like even family, friends, oh, your dad's a doctor, how come you're doing that?
I think people who spend time in hospitals like my dad did know how important nursing is, and how important it is that we have nurses who are bright and care about the job.
Joscel, I think Zach's actually Filipino. His whole family's nurses.
Yeah.
Oh,
absolutely.
Yeah. What about y'all? Like, have you guys heard that comment before? Like, why didn't you become a doctor?
I for sure heard that comment before, and it depends on the situation, but sometimes I don't even know what to answer them. It's just like, but mostly it's just like, because I don't want to be a doctor. But being a nurse, in my family at least, because you're talking about your family, it was like the expectation that you're going to be a nurse. My mom's a nurse, my cousin's a nurse, my aunt's a nurse, so we come from a bloodline of nurses. So it wasn't, I mean, to me, I was proud of graduating. I was proud of the blood, sweat, and tears I put in literally getting my nursing degree. But I feel like in relation and relative to our family, it was kind of like, well, that's the expectation. So it's not as celebrated in my family, to me at least, as if it was someone where, first to go to college, becoming a nurse. I feel like that's more celebrated than in my family personally. I was just talking to someone about that the other day. She loves her nursing license. She's the first to go to college, and it's just different culture, different backgrounds. So that was my experience with it, at least. But I definitely didn't. At one point I feel like I wanted to be a doctor, but I was like, oh man, I don't know if I want that responsibility. But a lot of patients, I think, definitely, like you said, Zach, always say that. It's like, you didn't want to go to more school, you didn't want to be the boss of everything. I'm like, not really.
It's nice to like be able to show up and do a 12-hour shift and like leave that at work and like leave those problems at work in some sense. I mean, obviously not every nursing role is like that, and nursing leaders and all those different things and the areas you can go into. But yeah, I think there is something to be said for like, I go to work, I show up, I, bust my tail for 12, 13 hours, and then I go home.
Yeah.
Yeah.
Yeah, and we definitely came from, like, we just talked about like our ages. We definitely came from a time when, like Joscel, my whole family is nurses. My brother, me, my mom, my dad,
Yeah.
friends, and all that. But like my immediate like high school group, or even my friends in college, a lot of them were like physical therapists or pre-med majors, pharmacy, and then they'd all look at me like, "Oh, why'd you choose nursing?" Or even when I got back from college and I graduated, and I met up with like friends that went into finance or business, they're like, "Oh,
Yeah.
you chose nursing? Why'd you choose that?" And then little did they know I was already making more than them at the same time. And then some of them actually quit their jobs that they graduated with back in like 2011, are actually nurses now. So
Wow.
it's weird how like that, like the tables have turned, or like the mindset shifted. And now like people are actually like seeing nursing as like a really solid profession to go into as well.
Yeah. I think it's interesting. Now, I also think it's kind of interesting because even though, like, we're talking about breaking stereotypes and we're talking about, even discussing some of those stereotypes, I do think there's, in some sense, a stereotype that nurses go into certain nursing specialties, or male nurses go into certain nursing specialties. And
Oh yeah, for sure.
I think we're all actually a different specialty. So maybe we are breaking stereotypes, because I'm ICU, but like, Brian, like, what inspired you to go into your specialty?
So I'm in the EP lab. So for people that don't know what that is, that's an electrophysiology lab. You do pacemakers, ablations, cardioversions. So it's more procedural. And the reason why I got into that was because the culture of the place is more like one-to-one type nursing, where you could actually just like do what you have to do. You feel like you really help the patient, and you're not so much like just task oriented. You got some autonomy. You get to work with the doctors shoulder to shoulder. I feel like there's a lot of respect there.
Yeah.
And it's something that I feel like I didn't have when I was working like the heart failure floor that I was on before. I felt like I was just like looking at like a med list, a task list, and that's what I was there to do, like push meds and wipe butt for 12 hours. And that wasn't me. And when I got to like this procedural area, I felt like I was actually doing more, helping more. And even like the workplace where I'm at now, there's significantly more male nurses than I've ever had around me before. Like sometimes even the best shifts are just when it's all dudes around.
In the EP lab, there's a lot of dudes.
Hell yeah.
I feel like there's a lot of guys in I'm coming from the ER mostly background. There's a lot of guys in the ER and trauma, and I'm not sure why. Because I know we're talking about breaking stereotypes, but the vast majority of nurses, I think, are still female. I think it's
87 approximately. Yeah.
80%. Yeah. So about a little over 1 in 10 nurses will be a male versus a female. But in the ERs, you're going to see a lot more males, at least in my experience. I came from the ICU as a new grad too. But when I moved down to the ER, I was like, wow, there's a lot of guys here. And of course, no employer will ever say, oh, we hire more men on purpose because it's the ER. But I definitely noticed there was more males in the ER than the ICU, or so the floors. Even if you're just transferring a patient up on the floors, you just notice there's no bros around. But like Brian was saying, when the bros are on shift, I love when the bros are on shift.
The guy see you.
The guy see you. That's some of the best fun.
Another topic that reminds me of is just when my coworkers, they say women are more catty. women are more catty. I like working with the guys because they're chill.
Less drama.
There's drama free, and you hear that a lot. And I don't know if that's a stereotype or what. And even if it is, that is a lived experience and topics and things we hear all the time, that men are just chiller,
right,
and more drama free. And I'd have to agree with that, because sometimes you see, and I'll go on record saying this over and over again, sometimes you see a lot of female nurses just going at it, but not going at it like physically punching or aggressively punching, but they're just like, they're throwing shade at each other.
A lot of shade.
right.
Yeah, and you're like, oh my God, are you guys okay? But we got to stay out of it.
I mean, if there's any piece of like male nursing privilege, it is like not having to engage in that kind of stuff and just like being hands off. I mean, whether they think you're too stupid to realize what's going on, or they just like, it doesn't matter. I'm like, as a traveler, I'm like, I don't care. Like that's y'all's thing, you know?
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
Well, I like how you brought that up as a traveler. I feel like, especially because I've been a traveler as well, if someone who was my equal but was a female counterpart comes into a new unit, I feel like as a male, I get treated better. With the same level of experience, same level of competency, and I've seen female travel nurses, they get kind of
100%
bullied in a sense.
So would you think that's like one of like the unique strengths of like a male nurse? Like even for me, I'm working with a lot of like physicians, and they will take my word over maybe like one of my female counterparts with more,
notice that,
or like a lot more strength to it. Like they'll listen to the dudes more than some of the ladies sometimes, which obviously isn't fair if everyone's bringing up like the same topic, the same answer, but they might take like the guy's word just more heavily than the female counterpart.
You think that's an unconscious bias? Probably unconscious bias, I'd have to say.
Yeah,
probably.
Now, what if it's a female doctor? Do you notice a difference between a female doctor and a male doctor in terms of how they are receptive to what you are giving for input?
You know, that might even come to, like, I don't want to stereotype, but it could go back into like the cattiness that Joscel was talking about. Just that sometimes there's that woman to women interaction that is just catty for no reason. But when I would bring up probably the same topic to this like female doctor, and she'll listen. But if someone else might have said it, she might think it's more like passive aggressive, or something like that. And then you could literally look at each other and be like, I literally said the same thing that she said, but you took mine way better.
I think the point is it's kind of a minefield, and like we're all kind of like walking around, and it's important to like be aware of our bias and be like aware of like, you know, why are we responding to things a certain way?
I think, I'm glad you mentioned the inverse, because I think as a male nurse, when we go into our female-dominated profession, people like us. People automatically think, oh, good, there's more guy nurses. But female physicians in a male-dominated field, it's an uphill battle for them. 100%. For us, we are absolutely not in that uphill battle that they face. And I feel like sometimes they have like a little chip on their shoulder, and it comes across sometimes. I remember I asked this doctor how to spell her name. I'm like, oh, you're so-and-so. I forgot the doctor last name. And she was like, it's Dr. So-and-so. I was like, yeah, I know. I just want to know how to spell your name. I forgot her doctor name.
Yeah.
I meant nothing by it. It was just like, why are you coming at me with a doctor thing? But probably she worked hard for that title, and probably in a male-dominated profession, she's being down-talked to as if she's not enough. Is how I walked away from that.
No, I have like a similar like experience with that too. So since I work in an area like with anesthesia and all that, so I'm going in to see a patient with like the anesthesiologist to interview the patient and go before procedural. And then we're both talking, we both introduced each other, but apparently the patient forgot who's the nurse, who's the doctor. So ultimately the patient ended up asking the anesthesiologist for a urinal. And then she's like, I don't do that, I'm not a nurse. And then automatically like kind of like pushed it off kind of like rudely, and like, he's the nurse, ask him for it, kind of thing. I was like, I don't.
I don't love that either.
Yeah.
And it's also, it's definitely not a you problem in that situation, right? It's definitely them.
Yeah,
Like that's not you. People blow up.
that's rough. I mean, I think those are always like the exception. I think the standard is that there's so many doctors and nurses who work so well together, regardless of gender, and that like it really has such a small bearing on the workflow for the most part. But it is an interesting thing to like talk about and be aware of. But I think you really hit the nail on the head talking about that concept of like how hard it is for a female doctor in terms of getting to that role and getting the respect that they deserve and that they 100% should have passively. It should not even be something that they're pushing for. It should be something that is given just like any doctor, any nurse should be given. But unfortunately, that's just not the way it is. And so I think that's why nursing is a little different, just because in almost every other sector of healthcare, of society, like women have it hard. They have they get the bad end of the deal. And like nursing is maybe the one exception where it's a little bit flipped. And so like the last thing I would ever want to do personally is come into anything like this and be like, oh, I'm a victim and like I have it hard and like that. Cause I mean, it's so important to acknowledge like privilege, exactly what you were just saying in terms of like people are more receptive. People are like, yeah, like we're great that you're a male nurse and all that stuff, and so we in a sense like we have it so much easier than so many of our female colleagues inside and outside the hospital.
Yeah. Well, also I like how you said that women do have a harder time outside of nursing, but also leadership in nursing I feel like is still mainly male dominated. What is your experience? What is your guys' experience?
I just had my first male manager this year. So out of like the 12 years I've been doing nursing, this is the first time I haven't had a manager that's male. And I think he might be like the only one that I know of other than like one of the APP directors, but he's also a PA. So it doesn't, I see mostly female.
I'd be interested to know the statistic of, there's more females than males in nursing, but how many more in leadership roles, talking managers, CNOs, what is the percentage male to female in that? So I'd be interested to know what that would be.
Yeah, I actually am similar to Brian in that, like, in all the hospitals that I've worked at, in all of the contracts I've taken over the years, I can only think of one ICU that I worked in. I mean, certainly there was like floors I got floated to where there were male managers and that kind of stuff, but of the ones I actually got assigned to, there was only one unit where it was a male manager, and all the other units I worked on were females.
So let's go into that, like the leadership, career growth. Do you think men just don't like that climbing that corporate ladder of nursing and would rather go to nurse practitioner or CRNA to further themselves?
That's a good question.
Because I personally, grad school dropout, still working as like a staff nurse, a RN, regular nurse. That's how I like to call it. So like, I wouldn't be able to like talk about like the career growth other than if I was to do it all over again, maybe I would have chose CRNA if I knew about it earlier in my career. And I would definitely choose it over like management.
Right.
Man, I wish I had the statistics. For me personally, I would choose management over CRNA. I would rather be a CNO over a CRNA.
Interesting. Wow. I mean, I think that, again, it's so hard to talk about these things without like stereotyping, because obviously everyone's journey is so unique. I am also, I still just do bedside nursing. And one of the things that I think is super important in nursing in general is the idea that nursing is the destination. It doesn't have to be a stepping stone. I think so many folks nowadays, they think that they have to go and do CRNA or MP school or, go back and do nursing leadership and get their, APRN and all that kind of stuff. I just think that's part of like how nursing has gotten a little lost, is just that like we think that nursing itself is not good enough. And I am against that thought. It's not that like if people do want to have aspirations to go and do other things, then they shouldn't do those things. But I think nursing can be the destination. And part of our responsibility as a healthcare system in the big picture is to like continue to make sure that we're providing value to nurses and that we're providing experiences and like opportunity for them to make a career that's not just capped off and they have to go and do something else.
I
Yeah.
love that, Zach.
Yeah, I want to dig a little deeper though. When you said they want to go do something else, do we mean like outside of bedside? Do
Either
we
or,
mean
yeah.
grad school? Because that's still nursing, right? And that's the beauty of nursing. Just because you go into management, just because you go into grad school, or for me personally, I work in pharmaceutical sales. Like I still identify as a nurse,
Right.
right? And it's
Right.
just a lot of the big majority of I think we all see it, where people are burned out and unhappy with their jobs, and they're asking what's next. It's because they're at bedside and they don't know what to do.
Right.
Is what I've noticed.
Yeah. I mean, I think that there's just so many situations, and again, this is from the 1,000-foot view of being in so many different hospitals and working in so many different places. There are states and there are hospitals where 100%, like I think people do view nursing as the destination. I think, um, starting my career in the South, like I started my career in Texas, and I have just sort of seen what like my home unit looks like now versus what it looked like 10 years ago when I started, versus units that I've worked at in, Los Angeles or in San Francisco, where those units have had the same nurses working there for 20, 25 years. And there are nurses there who like have made a full career out of nursing. And I mean, bedside nursing specifically. So yeah, I think there's just exactly that burnout and so many nurses who are feeling like they're in these losing situations. And yeah, it's discouraging.
So, like, regarding the burnout, do you think that's like that male superpower of being like super objective, where our feelings sometimes like we don't have it, that we're so easily able to leave certain toxic positions to go to try out new specialties? Like for me, I was able to go from a toxic unit. Well, no, it wasn't toxic at first, but it ended up being one, and then I end up just being like, all right, I'm done here. Let me go to the EP lab. Or like for anyone else, do you think that's like a thing to get out of burnout, which makes being that male counterpart, that mindset of being objective, and just something great for us to do, just to be able to do that?
What do you think, Joscel?
I think, well, I actually feel like it was because I felt more, because I was less objective, that made me leave bedside nursing. It was because I felt a certain way. It was because I was so overwhelmed by really just not liking my situation and being like, I really just do not enjoy coming into work. Like I always kept a good attitude. I always smiled, but I think the subjective experience for me rather than the objective is because I was getting lost in the subjective rather than like, oh, it's cool. It's just another day of a patient yelling at you. I'm like, no, like I really got, I feel like involved in that emotionally, that made me think like this is not healthy for me and I need out.
Yeah. And I mean, that probably just demonstrates that you have a higher level of like emotional IQ than like a lot of men do. And I think that's also part of the other problem when you're talking about that quote unquote superpower, is that like that means men are more like you're gonna pay today or you're gonna pay tomorrow. And like no matter what that damage is like on your like soul and the tax that kind of nursing takes emotionally, yeah, if men aren't like honest about that, or they're repressing that, or they're burying that down, then it can come up in some other way, and a lot, usually not a healthy way. And so
Yeah,
and again, you can't stereotype. That's an issue that like both men and women face. And I think a lot of women typically have more emotional intelligence and emotional IQ than men do, and so like
agreed.
they can probably navigate that better than some men can.
Well, I think, I mean, that's so hard. I know we've been talking about stereotypes, but I definitely agree that generally women have more and better emotional intelligence. Women are better to articulate their feelings and emotions, articulate it into words, and communicate that with other people.
Yeah.
And I think it's for that reason that I get along with women a lot better. Right. And obviously, I'm friends with both of you outside of this podcast, and I know both of you can articulate how you feel. And I think that's why I gravitate towards both of you. Not even just articulate how you feel, but articulate what you think about. And I can tell there is a layer of substance and depth that both of you have that I think a lot of males don't have, that I think when we talk to our male coworkers, and you could tell, like, there's some alpha males out there. They just need to dominate the conversation, dominate the room, and they have to be like, I'm a man, and that's kind of the energy they're giving out. You know, I'm a man. I'm the man of the hour. I like blah blah blah. And it's like,
and they don't listen at all.
Yeah, it's like, okay, dude. I don't get along with those types of guys.
No, me neither.
Personally.
Yeah, me neither.
So,
no, I appreciate that. And I totally agree with you. I think that is one of the superpowers of being under female leadership and being in a situation like socially with so many women, is that you do, I think, as a man, learn to have more awareness, because that's how women operate.
Absolutely.
They have that awareness and they have that global thinking of, like, it's more community-based thinking. They're considerate of other people in a way that those alpha males that you're describing are not.
right.
And that's like it's a cancer to like a culture in any setting, you know, that kind of like mindset and mentality. And women have so much better skills across the board than men do, I think, in that sense. If you're talking about breaking stereotypes, then nursing is a great profession for men. It's a great profession for women. I don't think that any man should be like afraid to go into nursing because of some stereotype. I do think that it takes a certain personality, but that's really doesn't have anything to do with gender, like what we were talking about. And ultimately, you know, there's so many great resources. There are a growing number of men in nursing, and like, you don't have to feel like you're alone. You don't have to feel like you're not a part of the nursing community if you're a man. So that's all I would really say.
Yeah, I think we've had great talks today. We talked about what it's like being a man in a predominantly female field and our experiences with it. I think it's been great. We've had some hot takes. We've had some cold takes. We've had some good stories. We've had some disagreements. But I think overall it's been really good. And thank you, both of you, for being open and talking about hard topics. If you're still listening to this, thank you for listening.
And so for everyone that's listening, so if you liked this episode, please give us a 5-star rating on any podcasting platform that you are listening on. And don't forget to follow all of us on social media, especially if you're a male nurse looking for people that have been through the trenches, have been doing nursing for over a decade. I feel like each one of us has a lot of value to give to new nurses, experienced nurses, anyone trying to get into different fields of nursing. We have like a whole bunch of experience going into all that.
Nurse.org, Nurse Converse. This has been another episode.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.